Well, just weeks after February 14th's tragic mass shooting in Parkland, Florida Governor Rick Scott signed into law the Marjory Stoneman Douglas High School Public Safety Act. It put in place broader reforms on guns and will invest $400 million to enhance school safety. It also will expand access to mental health treatment for students. With the start of class just weeks away, public schools across the state have been working to implement these new safety features. But there is one provision that is causing confusion for some parents and students. It requires students at the time of registration to list any previous school expulsions or arrests. In addition, they must also disclose if they've ever been referred for mental health services. But there is little explanation about what will happen with this information and who will have access to it, bringing into question students' privacy rights. Here to help explain this new requirement is Dr. Jean Cash, past president of the American Academy of School Psychology and a professor in the College of Psychology at NSU, Nova Southeastern University, and Carlos Larrauri, who sits on the board of directors for the National Alliance on Mental Health in Miami-Dade and is a family nurse practitioner. Gentlemen, thank you so much for being with us today. Really appreciate it. Carlos, let's start with you. Let's talk about the calls that you all are fielding from parents who are really concerned about this information. They're questioning, what is it that I put down on this application? How much do I reveal, right? What are they asking you?
Correct. Well, you know, NAMI, the National Alliance on Mental Illness, is the largest grassroots advocacy organization that advocates for individuals with mental illnesses and their families. As such, we have some concern regarding the law that was passed in response to Parkland, the tragedy that occurred at Parkland. As you were mentioning, what exactly is required to self-disclose is still up for interpretation. The law is quite broad and leaves it up to school districts to interpret and implement. As such, parents are also concerned, will this information be used in any adverse event or any adverse way against their loved ones? You know, this is a special and a vulnerable population, and as such, there are special ethical considerations that we must take into account when we collect information, including the family members and loved ones' right to privacy, and again, what will be used with that information.
Yeah, absolutely. Let's talk about that whole right to privacy thing. People have heard, Dr. Cash, about HIPAA. We've heard about FERPA. So tell us exactly what the difference is. And for people to understand, FERPA's the Family Educational Rights and Privacy Act. That's really geared towards schools, school information.
Correct.
And then Health Insurance Portability and Accountability Act. We've all had to sign those papers when we go to see the doctor that we've been explained our HIPAA rights. So explain to us, and we do have some information up on the screen, what the difference is.
Okay, first let me say I'm not an attorney, I'm a psychologist. And so this is not intended to be legal advice or legal information, but it is important to understand that FERPA applies to schools, at least all schools that accept federal funds, and HIPAA applies to healthcare service organizations or individuals outside of schools, or healthcare organizations or individuals with whom schools contract to provide services. The key information that parents will want to know is that the information that they provide about mental health referrals will become part of the child's educational record under FERPA. That educational record is kept private to the extent that other school information is kept private. And my guess is that most districts will keep that particular information in special folders that are not physically located with the child's cumulative folder, which has grades and classroom information and so forth. And it's protected in the sense that it cannot be released to the general public without parent permission or the permission of an adult student if the student's over 18.
Right.
So that's important to keep in mind. The other thing that's important to keep in mind is that there are some differences in the privacy restrictions with FERPA. That is, any employee of a school district who has a need to know that information for the benefit of the child, and that's an important caveat.
Absolutely.
Will have access to that information, and I'm presuming that the schools will use it to help screen kids for the possibility that they might be problematic or even violent.
Right, and I think that that's what people are concerned about.
Yes.
Who gets to see that information? Carlos, I want to go back to you. Talk about how important it is to have those mental health services in the school. I mean, you have a personal experience with that as well. Tell us a little bit about that.
That's right. I'm a young man living in recovery from an experience and diagnosis with schizophrenia. And my recovery was very much facilitated by having an open dialogue, a conversation between my family, my friends, and school officials. And it was by no measures perfect, but that really was a turning point in my recovery. Having that open dialogue, that conversation, allowed me to start seeking help and getting services. And we definitely need to move towards a system of care that integrates mental health providers in our school system and allows multiple pathways for accessing care. And as much as this law is well-meaning and intentioned and wants to move in that direction, we often see that the reality is, in many cases, the exact opposite sometimes. That laws such as this get in the way of people accessing care or cause more confusion than they do clarity. As we know, families and parents are concerned that, will the information be safeguarded?
Yes.
Will it be used in any way to stigmatize their children or discriminate against them?
That's such a great point. I mean, and either one of you can chime in here. Do you think that the new law, which aims to do some good after what happened in Parkland,
Right,
to give all of this millions of dollars now into mental health services for our students, that it could end up doing more harm than good, as Carlos was kind of saying, because people are afraid to release that information? We kind of go from one extreme maybe to another, where maybe too many people didn't know, and that was sort of the question with Nicholas Cruz, the shooter, wasn't done for that young man.
Right.
And then maybe people are afraid too much information is going to get out there. Dr. Cash, what do you think about that?
Well, first, I think that providing funds to hire more mental health professionals for schools is a really good idea. I may be biased because I'm a school psychologist, but hiring school psychologists and other mental health professionals is something that has the potential to be of incredible benefit to the schools and to society at large. Obviously, that depends upon how those professionals are used, how the money is used, and how the information that's provided by parents is used. The concern that I have, one of the biggest concerns, is that requiring that kind of personal information may drive parents away from public schools and have them take their children to private schools that are not governed by FERPA and that are, or that is the data of which are not governed by FERPA, and increase the tendency to privatize education in general and to have a two-tiered system, private schools versus public schools. That's one concern. The other concern is how schools will respond to the fact that a child has a mental health referral or a mental health background. If that's used in a positive way to get that child some extra help in school, and it's kept,
that's a good thing.
And it's done in a very professional and in a way that safeguards that information, then it could be a great thing.
Yeah. So
always
we'll have to see.
There can be
Concerns.
things that go wrong.
Absolutely. Gentlemen, thank you both so much. Great to have you here. We really appreciate it.
Sure.
And you have a question or a comment about disclosing students' mental health history, send us your take. Post a video or a comment on our Facebook page or Twitter @YourSouthFL. We look forward to hearing from you.